Evening and a very happy Diwali to all. On behalf of the College of Nursing, Clinical Nursing Services, Department of Nursing, and the Telemedicine Center, Department of Psychiatry, NIMHANS, I cordially welcome all of you to the launching ceremony of the NIMHANS-Telenursing Practice Guidelines 2020. We are very happy that all of you could join us for this program virtually. NIMHANS has always been a pioneer in spearheading some of the landmark initiatives, be it related to direct patient care, facilitating in utilization of research, incorporating medical technology into clinical practice, or in initiating various public health policies. NIMHANS has been a forerunner in all these. The telemedicine facility at NIMHANS is one such, which allows for the provision of care from a distance and facilitates the accessibility of health for all. Today, we are going to witness yet another landmark initiative from NIMHANS, and the entire nursing team of NIMHANS is delighted to take a lead in the launching of the NIMHANS Telenursing Guidelines, Practice Guidelines 2020. This practice guidelines has been a culmination of months of passionate teamwork and concerted efforts of many from nursing as well as the faculty from the Telemedicine Center of the Department of Psychiatry. As we begin the formal program, I request Professor Vivi Katyaini, the Principal, College of Nursing, to kindly deliver the welcome address.
Thank you, Priya. A very happy Diwali to all. A hearty welcome to NIMHANS. As light symbolizes to the knowledge, on this auspicious day, we the Nursing College, Clinical Nursing Services, and Department of Nursing, along with Telemedicine Department of NIMHANS, happy to launch NIMHANS Telenursing Practice Guidelines. First of all, I would like to welcome our beloved Director and Vice Chancellor of NIMHANS University, who has been the source of knowledge and inspiration and who has extended unconditional support to launch this program. In spite of his busy schedule, he has accepted our invitation to inaugurate the program. Sir, we the nursing fraternity of NIMHANS are extremely happy that this program is going to be inaugurated by one of the world's renowned scientists. We welcome you, sir. The name we all nurses are familiar, and the person who needs no introduction, and all his achievements speaks in volumes. He is none other than our beloved President of Indian Nursing Council, Dr. Dilip Kumar. He is the pillar of strength and a visionary in the field of nursing. Sir, we thank you for accepting our invitation and joining us. We, the nurses of NIMHANS, happy to welcome you, sir. I take this opportunity to welcome Major General Retired Dr. A.K. Singh, President, Telemedicine Society of India, who is well known to NIMHANS. He is kind enough to accept our invitation in short notice to be the part of this program. A hearty welcome to you, sir. In the history of nursing at NIMHANS and in India, the name nobody can forget is none other than our beloved former senior professor and Dean of Behavioral Sciences and at present Nodal Officer, PhD Consortium, Dr. K. Redemma. She is the backbone of this program, who is unconditionally and wholeheartedly supported this program. Ma'am, we welcome you. I am pleased to welcome Dr. Roy K. George, National President, Trained Nurses Association of India, New Delhi, who has gone through the content and encouraged us to take up the initiative and also accepted to speak on this occasion. Sir, we welcome you. I am happy to welcome all the Deans, Registrar, MS and RMO of NIMHANS. I take this opportunity to welcome Dr. Pratima Murthy, Senior Professor and Head Department of Psychiatry, who extended unconditional support and guidance. We welcome you, ma'am. I am happy to welcome our beloved Dr. Sai Lakshmi Gandhi, HOD Nursing, and Ms. Nirmala Hatti, in charge, Head Clinical Nursing Services, and to this program, who have taken their time to review the contents and encouraged us to launch the program. We welcome you, ma'am. I welcome all the HODs and their members, and all. I also welcome all the reviewers, professional colleagues, well-wishers across the country and around the globe. I also extend my sincere welcome to Dr. Ramachandra sir, who was the former principal, College of Nursing. I welcome Dr. Suresh Badamat, HOD Telemedicine Center and Community Psychiatry, NIMHANS, who has been constant and continuous support and instrumental and source of knowledge who made this day possible. I also welcome Dr. Manjunath and Dr. Naveen from Telemedicine Department to this program. I also welcome Dr. Prashanthi Natala, Dr. Radhakrishnan from Department of Nursing. I welcome all my colleagues, students of College of Nursing and all clinical nurses to this program. Once again, I welcome everyone. We are confident that we will continue with even more success. Let us remember the saying, Paropakarartham idam shariram. Let serve others. I wish everyone safe and healthy Deepavali. Thank you.
Thank you, ma'am. We extend a hearty welcome to you too. May I now request Professor G. Gururaj, the Director, Vice Chancellor, NIMHANS, to kindly inaugurate the launching ceremony as well as address the virtual gathering. So please.
Distinguished dignitaries of today's program, Dr. Dilip Kumar, Dr. Singh, Professor Rajama, Professor George, Professor Pratima, Head of the Department of Psychiatry at NIMHANS, all of our colleagues at NIMHANS and friends. It's indeed one more historic day at NIMHANS with the launch of this program, the Guidelines for Telenursing Services 2020. In the last few months, rather than the 10 months in the beginning of the COVID, and with the reporting of the first case of COVID in India on January 30th, the country has seen a huge change in the healthcare services, in the healthcare delivery, as well as in the new initiatives that have been launched across the length and breadth of the country. Three words clearly stand out at this time: tele, digi, and COVID. And all three are very closely interlinked. Because of the COVID, the telemedicine and telehealth services have really received a very strong boost, and it has become one of the major pillars in the healthcare delivery components today. With several changes that took place during the COVID times, it was recognized that delivering healthcare services has become very difficult, especially to those who work in distant, far off, remote, inaccessible areas. With more number of elderly people having difficulties and being unable to travel to hospitals, with the costs of the healthcare system going high, and also with the need for delivering services irrespective of their ability to either reach or to pay, innovative solutions had to be developed in the country. And in that context, telemedicine and telehealth have really come into prominence. And this has also become one of the more cost-effective and a sustainable mechanism to deliver healthcare. Nursing professionals across the country are at the forefront, whether it is in doing triage, whether it is in managing, or whether in community care, or even in testing and screening. In many activities, nursing professionals, nursing staff are at the forefront and come in direct contact. And since many of them are unable to be in touch with each other, to be in touch with some of their professional colleagues from other disciplines, the tele-nursing services has become very important. The tele-nursing, it could be ranging across a wide variety of areas, starting from triage to tele-consultation, tele-diagnostics, tele-monitoring, tele-healthcare. To many of these areas, it becomes a very essential tool. It becomes much more important for nurses and nursing professionals because they share and shoulder several responsibilities in their day-to-day activities. And they need constant support, constant learning, as well as continuous professional support. And telenursing comes very handy in these situations. I would like to compliment the team at NIMHANS, which has worked on developing these guidelines. It has gone through several revisions, got opinion from several experts, incorporated many guidelines that are already there, and made it very specific to the nursing community at large. I'm sure these guidelines will be very helpful and will be put into use across entire country, and all of them are going to be benefited with this definite exercise. As we go along, it becomes important to improve on the technological front and also to look at some of the legal, ethical, and other considerations which play a huge role in teleservices in terms of privacy, confidentiality, and several related issues. I'm sure they'll be addressed. These guidelines, while they are general covering all aspects of nursing, have also placed major emphasis on mental health issues because the nurses need that constant psychosocial support in their day-to-day life to continuously keep on working and in providing care. So in that way, these guidelines are going to be very useful for the nursing community at large, and I'm sure this will be put into use by many of the people, and your suggestions and feedback will help the team at NIMHANS to continuously improvise this particular work. I wish all the best for this program, and I wish all success in its implementation during the days to come. Thank you very much. Namaste, and a very happy Deepavali.
Thank you, sir, for inaugurating the ceremony and for those words of encouragement. We at NIMHANS, the entire nursing team, is extremely proud to function under visionaries like you. I would like to inform the participants that those who want to receive the draft of the NIMHANS-Telenursing practice guidelines, you can drop in your email in the chat box. We will be getting back to you. To the public, the practice guidelines will be available at the NIMHANS website in a week as we are finalizing the draft. So now I may request, it is my proud privilege now to request Dr. T. Dilip Kumar, the President, Indian Nursing Council and the ex-nursing advisor to the Government of India, to kindly address the virtual gathering. Sir.
Vice Chancellor of the NIMHANS, Dr. Gurraj ji, Dr. Ashok Kumar ji, President of the Telemedicine Society of India, Dr. Redama, Dr. Katyayani, Dr. Roy George, President Trained Nurses Association of India, Dr. Vijay Lakshmi, Dr. Jyotimani, and Dr. Pratima, the head of the unit of the psychiatric from the NIMHANS and distinguished invitees to this virtual launching of this telenursing guidelines. And first of all, I would like to congratulate the NIMHANS, College of NIMHANS, for taking the initiative for developing the telenursing guidelines. And also, it is a befitting when the world is celebrating 2020 as an International Year of the Nurse and Midwife. The World Health Organization has for the first time has come out with the status of the World Nursing Report. So in this year of 2020, I think nursing fraternity globally is not able to celebrate, to commemorate the 200-year birth anniversary of the Florence Nightingale. For the first time, World Health Organization has given such a high pedestal to the nursing fraternity at the global level. Due to the COVID, we are not able to celebrate it, but it has given an opportunity for the nursing fraternity where they have taken the very central role in the treatment care support of the COVID-19 patients. So in this year, the NIMHANS rightly has innovated one of the launching of this telenursing guidelines, which is going to be a very big step for in the healthcare delivery system. So the telenursing is happening here and there, but there are no structured guidelines are not available. And especially All India Institute of Medical Science did one study where using the two nurses contacting the cardiothoracic patients and to their residents and arranging the appointments, rehabilitation process, and it has proved that the admissions to the cardiothoracic OPD has reduced to a larger extent, and it has facilitated the patients for appropriately fixing up the appointments with the various departments in the cardiothoracic department. So this itself shows that already some sort of a telenursing which is happening, and especially in the rural area where our auxiliary nurse midwives, the auxiliary nurse midwives already start talking to the various patients through the telephones and giving the teleconsultations, so which is going on. But giving this guidelines has given a structured guidelines which is going to facilitate for the nursing fraternity to launch for the telenursing. Many of the specialization people will be able to take on, and we at the Indian Nursing Council will be very happy to go through this. I think I had shortly I've gone through these guidelines. I think I'll be very happy to take this guidelines to my experts, so that once it has approved by us, it will have a structured Indian Nursing Council is going to give the approval for these guidelines, so that there you have to train the nurses to take on this telenursing as one of the activity. And many people, I think now Government of India is going to amend the Indian Nursing Council Act in the form of the National Nursing Commission for the Midwifery, Nursing and Midwifery. In that, scope of nursing and midwifery practices are going for the first time. Because earlier, the Indian Nursing Council Act, we did not have the scope of nursing and midwifery practice. So in the scope of nursing and midwifery practice, as in principle, the Ministry of Family Welfare has accepted to include in the BARE Act itself. That gives a lot of scope for the National Nursing and Midwifery Commission to include this telenursing is also one of the specialization, where so that legally the awareness of the public, as our Vice Chancellor in the inaugural address itself, a lot of legal and ethical issues need to be kept in mind. So therefore, once if it is included in the scope of nursing and midwifery practice, then our professional will be able to practice very effectively. And also this is going to give, and also it is going to include the coverage of the healthcare services because of the shortage of the nursing professionals, and also the healthcare delivery system is already overloaded with the existing the workload. So therefore, the telenursing is going to act in a different specialities, especially in different areas. And recently, Russia was able to come out with one of the innovative method of the telenursing. The nurse-led TB nurses was able to launch this for the TB patients. They started with initially with the 6 patients. Now they are having about 150 patients, and during this process, they have come across how the patient satisfaction and the adherence of the drug adherence has increased. So therefore, it is evidence is available for to take on this telenursing, and so therefore this launching of this telenursing modules is very timely, and therefore we will be able to hope the this is going to be practiced in the NIMHANS, and especially for the counseling purpose. This is going to make a much of a difference. And recently we were having a discussion with the Dharwad or nursing fraternity people, and during this COVID-19, they were having a lot of tele counseling which was going on, and many of the people, they were thinking that they had 2 or 3 layers of counseling, and they thought they will refer the lot of patients to the higher level, but lot of the counseling was managed by the nurses itself. So therefore, the nurses are their course of instruction is so comprehensive. So they will be able to deal all issues which the patients are going to ask, and also they will be able to refer it to the right places, and the treatment and care and support is going to be very useful. It will be patients are going to be benefited with this, and the healthcare delivery system is also going to expand with this telenursing. So in this context, once again, I would like to congratulate the NIMHANS for initiating this launching of the telenursing modules, and Indian Nursing Council is going to support this initiative, and also this can be a case study can be started, so that this case study can be in a longitudinally, we can make a research process, and we can share this research process to the International Council for Nurses, so that our evidence also can be shown at the level of the global level. So therefore, in that perspective, Indian Nursing Council will be willing to support for this initiative for the NIMHANS for the telenursing module. Once again, I would like to congratulate all the team members who have worked very hard to develop this telenursing module, and wish you best of luck. Thank you very much.
Thank you, sir, for those extremely encouraging words. It is extremely correct and extremely befitting for us, as you rightly pointed out, that in this year of Nurse Midwife 2020, NIMHANS Nursing Fraternity is launching the practice guidelines for telenursing. I may now please request Major General retired Dr. Ashok Kumar Singh, the President of Telemedicine Society of India, to kindly address the virtual gathering.
So kind of you, and my greetings to all of you who are sitting there, the dignitaries. Dr. Dilip, you have been very kind, the principal madam, and Namaskar, Professor Saab, the director. Now, on behalf of Telemedicine Society of India, my Namaskar and Happy Diwali to all of you. Telemedicine Society of India is a non-profit organization, as all of you know, and we have got 11 state chapters, and we have got special rates for the nursing staff, so they can become members, and it will become a very good thing which is there. Now, a few things which my experience has been there, that in Rajasthan we had a PPP model, public-private partnership model, where we had 150 nodes, and all these 150 nodes were managed by nursing staff. And every day we used to have about 500 to 700 consultations daily. So I really appreciate NIMHANS to take on this nursing guideline which you are now giving it out. And I believe you are also going to conduct a course which the TSI would love to share and carry on with the course. It is very important that the telemedicine guidelines have come in. It's a structured model. You have to be very clear on the documentation. The most important is documentation, because then only the legal and ethical things will come in. So anyone who takes on, and we insisted that you have documentation takes place. So that is my take on it. I don't want to spend more time. Finally, on 18th to 20th of December 2020, we are having Telemedicon 20. It's an international conference of Telemedicine Society of India. And with this launching, I would want and I would request that we have a number of papers from the nursing faculty. It'll be a pleasure to invite all of you. And we have, because it's a virtual meet, we have ensured that everything is, it'll be 3 days and it will not take much of time. So please log into Telemedicon 20 website and have a look. Thank you, and wishing you a very, very successful telemedicine practice guideline. Thank you, madam. Thank you, all of you.
Thank you so much, sir. Thank you so much. We are very happy. We are very thankful to you that you have addressed us and has raised the occasion. We are very sure that NIMHANS, our leaders, will take forward the work that you have been doing. Extremely thankful for raising the occasion. So thank you so much. It is my privilege to welcome our Professor Dr. K. Redamma, a person who is so close to the heart of all the nursing people at NIMHANS. To kindly, she was our former dean and the former senior professor at the Department of Nursing, NIMHANS. I may please request now, madam, to kindly address us. Ma'am, please.
Thank you very much, Priya. First of all, I congratulate the team for developing the guidelines. And as always, NIMHANS has always been in the forefront in developing, many protocols and many issues. They were in the forefront. And I'm so happy that you are keeping up the trend. And though I have retired in 2013, I still feel part of NIMHANS because of the heritage that we have been carrying on forever. Well, when it comes to the actual practice guidelines, I have gone through the guidelines and I also added and told some suggestions. But what are some of the applications of this telenursing? One thing, the self-management of the people who have some ailments which are chronic, and this can be befitting now because even in the rural areas, people are very well versed with the technology. That is, they are able to have conference calls, they are able to be on the video calls. So that is because of the migration of people from rural areas to urban areas and also other countries. Hence, it is the right time that we can initiate such activities. One thing, travel time is reduced, timely advice is received. But how well we can conceptualize the whole thing, like I was talking to Vijay Lakshmi, we should have very clear-cut message going to the patients and not so much in detail, not to overwhelm them, but what is required for the point that is necessary. It is necessary to have close monitoring of the people in emergency visits, and this can reduce the number of hospital visits and also management of behavior when it comes to mental health issues. Like NIMHANS has already experimented on teaching the family members how to manage their behavior. There are some disadvantages as well, that is loss of personal relationships, physical assessment is not possible, and concluding based on what they have spoken is going to be a little difficult task. Sometimes the technology can play mischief. That is, calls can be interrupted and connectivity problems can occur. These are some of the problems that you may come across in future. Some of the ethical dilemmas. have I told the right thing? Or have I made a mistake in giving instructions? So these ethical dilemmas are a common one because I myself experienced once when I was doing reproductive health issues. But then, to my good luck, at the same point, there was an international conference on reproductive health going on, and what I was telling to the people was exactly same what was coming in the newspaper every day. So I not only felt comfortable, but patted myself. Then some of the integrity and documentation. See, these days people are very smart. The whole conversation you and patient had can be recorded by the patients. So how integrity plays a role in documentation. And documentation, as Dr. Singh has pointed out right now, is very important for legal issues. Then non-verbal cues can be missed, and sometimes caller identity is doubtful because the person who is calling may not be the real patient. So the information that a patient could really give about the health condition can be doubtful. So how do we set priority? So in your questioning about the symptoms, you should be very clear as to where to start and which one is very important and which one can be addressed first. Then cost efficiency, it was already talked about. Responsibility and information. To be responsible to give the right information, you should have a thorough knowledge. My vision for this endeavor is to have definite inputs from the people who are working in the periphery. So there are two issues. Are we going to counsel the patients? Are we going to counsel the nurses who are going to address the issues of patients at the periphery? So there has to be two different types of streams of guidelines. Then one should be very good. What is the future of telenursing in India? And according to me, the focus should be interpersonal and communication skills are very, very important. Listening, active listening is very, very important so that we don't miss out on any of the information given by the patients. Then we have to have competencies in the clinical nursing so that we are able to give to the point and correct guidelines. Then there has to be dedicated staff and time schedules have to be strictly adhered to. So there is very definite issues regarding who is available, how knowledgeable that person is, and what is the time schedule and the person's availability during that period. Then I have already spoken about, it will be worth investigating. Like we had a system of people going from tertiary hospitals to the periphery and people coming from periphery to tertiary hospitals. So that actually it's very easy job for people working in tertiary hospitals because they come with the symptoms, they come with this thing, and there are other people to consult each other and be comfortable. But when you are in the rural area, it is very, very difficult to pinpoint on the signs and symptoms, and it requires a different skill to perceive what the person is suffering from, and it should be a problem-based approach. So we may have to think of problem-based learning issues in telenursing. Then systematic assessment formats, standardizing the protocols, and documentation and liability should be very, very carefully looked into. Documentation has to be very meticulous, and keeping up-to-date knowledge is very important. Keeping up-to-date knowledge, what I mean is You have to update yourself every time that a new disease crops in or new health issues crops in. One has to keep abreast of the developments in the healthcare system so that you are comfortable in giving the right kind of information and right kind of instructions. First of all, I would like to once again thank the organizers for making me the part of this program, and especially to Dr. Suresh Badamat, Dr. Katyayani, and Dr. Vijay Lakshmi and Dr. Priya, who came and discussed with me. And I feel proud to be part of this program. Thank you.
Thank you so much, ma'am. Thank you so much. Those were words of wisdom stemming from your experience. And indeed, we are proud to continue the legacy that you have left behind. And all this work that we are doing is a continuation of the legacy that you have left behind. And between, ma'am, we always feel that you are still a part of NIMHANS. Next, we have with us a very key nurse leader of the country, Professor Dr. Roy K. George. He is the National President of the Trained Nurses Association of India and the member of the Indian Nursing Council, as well as the Academic Director of Baby Memorial Hospital at Kozhikode, Kerala. Sir, I may please request you to kindly address us.
Good evening to all. I really feel privileged to be here with the eminent speakers and the hands, which is my mother institution for MSc nursing. So first of all, let me congratulate the College of Nursing NIMHANS for organizing this seminar for informing on the guidelines for telenursing. And from Trained Nurse Association of India, I would like to offer that we will be happy to help in spreading the telenursing guidelines, because telemedicine has already in air and the government has approved it. So we will be definitely happy to cooperate with and make sure that it reaches as much as people possible. Sorry that I was in another meeting. I could not come in earlier. I could not hear all the speakers. So from Trained Nurse Association of India side, we will be definitely happy to spread this message to the nurses and spread these guidelines so that it will reach maximum number of nurses. Thank you very much. Thank you very much, and congratulations once again to the College of Nurses. Thank you. Thank you.
Thank you, sir, for all the encouraging words. Your determined efforts in various issues of nursing is something which keeps sailing nursing and encourages us to move forward. Thank you so much. We will now have a presentation about the telenursing practice guidelines of 2020. These guidelines have been prepared by a team of passionate people from various disciplines. And from the College of Nursing, Dr. P. Vijay Lakshmi will be presenting the practice guidelines now. I request Dr. Vijay Lakshmi to kindly present the guidelines. Thank you.
Good evening, one and all, and we are very thankful to the distinguished guests for giving valuable suggestions and your encouraging words. And now we move upon to draft presentation of NIMHANS-Telenursing practice guidelines. Prior to that, I'm pleased to inform you all that NIMHANS, being premier institution, it has released telemedicine guidelines so far, and tele-operative psychiatric guidelines and psychiatric social work guidelines and tele-psychotherapy guidelines. And this is the fourth one we are releasing today, and many more yet to come. And so this is the one happy message for us. And move on to the NIMHANS-Telenursing practice guidelines draft. And this draft of guideline discussed under 6 chapters. First chapter included background and definitions and scope of guidelines. And second chapter dedicated to discuss about technology and mode of communication which is necessary to practice telenursing, and etiquette for telenursing practice, what we expect for the professional behaviors from the nurses who practice telenursing. and guidelines for telenursing practice included in the fourth chapter. Those are the essential elements for telenursing practice. As we all know, we work very closely and collaboratively with registered medical practitioners. So four situations we have prepared. That is the consultation between registered nurse and registered medical practitioners at various levels, and other situation, few examples for other situations where telenursing is applicable also included in the fifth chapter. And the sixth one is appendices, assessment forms and consent form, may be optional, and which may be included in the final document. Coming to the need for the telenursing guidelines, India being a developing country, it has 138 crores of population, and majority of the population live in rural India with limited healthcare facilities. And India is facing shortage of healthcare providers. We have acute shortage of 6 lakhs doctors and 2 million of nurses. And another important factor is the whatever the healthcare services we have, it is unequally not equally distributed. And telemedicine is an emerging field in India. As Redama Madam was speaking about benefits of the telemedicine services, I also would like to say that it saves time, cost effective, and easily accessible. And in one word, we can say that telehealth everywhere. And a national health initiative, Ayushman Bharat, Indian government is committed to provide comprehensive health services to each and every corner of the country through health and wellness centers. All the existing sub health centers and primary health centers will be transformed to health and wellness centers. These health and wellness centers are digitally connected with the hubs at medical colleges and district hospitals, so that the patients from rural area can avail and can be accessible to the tertiary care services or specialist services. And the another milestone in the telemedicine field in India is the e-Sanjeevani. E-Sanjeevani is a telemedicine service which is implemented at the level of health and wellness centers across the nation. And e-Sanjeevani is gradually shaping into a parallel stream for Indian healthcare system, as it is well accepted by both healthcare providers and patients. And another landmark is launching of e-Sanjeevani OPD, Stay Home OPD app, which enabled essential provision of essential healthcare services through teleconsultation between the patients and healthcare providers during the pandemic situations like COVID-19. When it comes to telenursing, at the subcenter level, nurses are mid-health level mid-level health providers are maybe registered nurse, Ayurveda practitioners or Ayush practitioners may lead the sub-health center, health and wellness centers. And when the nurse work at sub-health center level, she can initiate teleconsultation between the patient from rural area, and she can coordinate the patient complaints with the at a higher center and see that help the disadvantaged population in reaching essential services. And currently, there are no guidelines are existing in India on telenursing practice. And purpose of the nurses to adhere to ethical and professional norms and direct them to be accountable for the care offered by them. And we have to remember that these are the not the standalone documents. We should be used in conjunction with other national clinical standards, protocols and policies and procedures. And I'm not going to discuss much about definitions and applications of telenursing, as because of the limitation of the time. This is the definition taken adopted from given by World Health Organization. And the definition of telenursing adopted from the definition given by International Council of Nurses in 2009. That is the use of telecommunications technology in nursing to enhance patient care. It involves the use of electromagnetic channels to transmit voice, data, and video communication signals. And for the purpose of this document, registered nurse has been defined as an individual who has completed minimum general nursing and midwifery course or BSc in nursing course and has enrolled in the State Nursing Council or Indian Nursing Council under the Indian send if you are providing your email ID. And one important thing I would like to emphasize is the nurse should have dedicated office mobile or landline number and email ID. At the same time, should have a special account to provide services to the patients. And the third chapter includes the etiquette for telenursing practice. So the do's, the professional behaviors expected to practice telenursing were discussed under 6 headings, that is environment, professional attire, effective communication. What are the do's and don'ts under professional responsibility and accountability, legal and ethical considerations, and documentation. And coming to the guidelines for telenursing practice, the essential elements required for practicing the telenursing includes context, identification of RN and patient, mode of communication, consent, then assessment of the patient, patient management, which includes clinical care, health education and counseling, and documentation, and professional accountability and responsibility of the registered nurse. When it comes to context, in the phase of the context, the RN has to make a brief assessment of the patient's complaints and should communicate with the RMP. And in collaboration with the RMP, they have to decide what type of care the patient needs, whether patient needs any emergency intervention or teleconsultation with the RMP is enough, or requires in-person consultation. The second essential element is identification of RN and patient. In telenursing practice, both the patient and registered nurses should identify each other. Suppose in case if patient make a call from patient's home to health and wellness centers, then the RN has to identify the patient with the patient name, age, gender, and email ID, and other basic details of the patient. When patient comes to the health and wellness center for the first time, she has to collect the basic details of the patient and maintains the health record. And if patient has come for a follow-up visit, she has to confirm from the details of the patients from previous health record. And mode of communication usually we apply in telenursing could be video, audio, or message thing. And depending upon the patient's symptoms and preference of the healthcare providers, the registered nurse has to initiate the teleconsultation using these modes of communication. Suppose if patient has developed rashes all over the body, or if in case of an emergency like road traffic accident or something, when the healthcare providers feels that it is better to understand the context, then they have to make the mode of communication to be real-time audio video consultation. Then consent, the consent can be implied consent and explicit consent. Sometimes patient may call the nurse at the health and wellness centers from home. Then when patient initiates he himself, then we say it is the implied consent. And explicit consent usually in telenursing practice when the patient visits health and wellness centers and the RN is initiating teleconsultation with the RMP for the patient's sake, then it is the explicit consent. So in telenursing practice, usually it could be explicit consent. Then assessment of the patient, the RN has to make, based upon their knowledge and skills, so she has to take detailed assessment of the patient, and she has to communicate same with the RMP so that they can it can be helpful in providing appropriate treatment. During home visits, the registered ANMs and Anganwadi workers or ASHAs may not have adequate capacity to take detail to identify the patient complaints. So they have to undergo brief training how to identify patient complaints and how to communicate to the RMP at the health and wellness centers. And when it comes to patient management, it includes clinical care, health condition, and counseling and documentation. So clinical care includes in collaboration with the RMP sessions, the RN monitors the vital signs, distributes the medicines as prescribed by the RMP, and wound dressing and suture removal, administration of IV fluids and medicines, and facilitates referral to the other health team members such as physiotherapists, speech therapists, dietitians, social workers, as suggested by the RMP, and based upon the needs of the patient, she will refer to other care team members. These are the few nursing activities under clinical care, but the list is not end. When it comes to health education, educating the patients on lifestyle changes, diet, stress management, management techniques, mental health promotion activities. These are the nurses play a key role in educating the patients, and they can use educational videos to educate patients to take care of themselves. The other day when I was discussing with Redama madam, she was so keen on this point. We have to make empower the patients by providing necessary information. When it comes to the medication management, it is necessary to develop written protocols and standards for telenursing practice regarding medication management. For example, a woman throughout perinatal period requires supplements like iron, folic acid, or calcium supplements throughout the perinatal period. And if a standing order is there, then she can distribute the medicines as and when necessary, or whether again she has to take RMP's permission. All those things we have to have written protocols and standards. Same way, in case of patients with tuberculosis or any other chronic illnesses such as mental illness, etc. And nurses are legally liable for wrong advice, medication errors, etc. So hence they need to update their knowledge on medications, including action, duration, side effects, and interactions, etc. And the last essential element is professional accountability and responsibilities of the registered nurse. Registered nurse would be required to fully abide by Indian Council Act 1947 and with related provisions of IT Act, data protection and privacy law, or any applicable rules notified from time to time for protecting patients' privacy and confidentiality, and regarding the handling and transfer of such personal information regarding to the patient. And registered nurses will not be held responsible if a technology breach or by a person or other than RN occurs. For example, we if any flaws like in technology itself, we may not registered nurses may not be held responsible. Then other thing, we may have separate account and we send the patient e-prescription or patient related data to the mobiles of the patients. If they are not protecting their information confidentially, then registered nurses will not be held responsible in these issues. And nurses are legally liable for some misconduct behaviors related to telenursing. These are the some examples. Registered nurses insisting on telemedicine when the patient is willing to travel a facility and or requests on in-person consultation with RMP. RNs misusing patient images and data, which are especially private and sensitive. For example, RN uploads an explicit picture of the patient on social media, etc. RNs, if they give any inappropriate advice out of their professional boundaries, also they are legally liable. And RNs are not permitted to soliciting patients for telenursing through advertisements or inducements. And fifth chapter includes the framework for telenursing practice. We have taken 4 situations where the consultation occurs between registered nurse and registered medical practitioners, and other situations where telenursing practice can be done. The first, I'll try to explain with flow charts. And before initiating consultation, these are the essential consultations. The first one is professional judgment based on registrar's knowledge and skills. They have to communicate, they have to assess the patient, what type of care patient requires. They have to assess and communicate with the RMPs, and they have to decide about the treatment. And mode of communication, again depending upon the preferences of the healthcare providers and depending on symptoms of the patient. The RN should not proceed with the teleconsultation if patients are not interested or request an in-person consultation. The RN should remember that both patients and nurses have the right to choose to discontinue the teleconsultation. Flowchart 1, consultation between a registered nurse and registered medical practitioner at sub-health center, health and wellness center. Proposed setup, the health and wellness center at sub-health center level is accessible to the rural population within 13 minutes, and it would be led by mid-level healthcare provider, could be a registered nurse or an Ayurveda practitioner. And these centers act as the first point of referral for the healthcare needs of the patients at the health and wellness centers level. If patient requests are affordable, nurses can initiate teleconsultation with the RMPs in private healthcare setup. This is the flow chart which explains the consultation between the registered nurse and RMP at sub health center level. Patient visits health and wellness center and approaches the RN. RN identifies the patient and takes the patient's brief details of patient like age, gender, address, etc., and makes the health record. And the next step is assessment done by the RN based on standard operative protocols and guidelines. If the RN suspects emergency care is required, then the RN obtains consent from the patient and initiate teleconsultation, maybe audio or text or video mode, with the RMP either in government facility or private facility. And the RN provides immediate relief measures and first aid as suggested by RMP and guide patient for referral to the nearest healthcare centers, either primary health center or community health center. If patient do not require emergency care but still insists RN for in-person consultation with RMP, then she facilitates the referral at a higher center. If patient is okay with teleconsultation with RMP, then she obtains consent from the patient or family members and initiate teleconsultation with RMP. And based upon the treatment provided by the RMP, she provides the nursing care, which includes clinical care, that is obtain e-prescription, distribute the medicines as per the prescription, then referral, facilitating the referrals and provide nursing care based on the needs of the patient. And health education and counseling includes reinforce about medicines, including dose, duration, side effects, guide the patients for live lab investigations, provide information about disease condition, provide emotional support based upon the concerns of the patient and family members, inform about the follow-up visits, and the same thing she can be documented for the legal purposes. And the RN may advise the patient or caregiver to call her back if the symptoms worsen or new symptoms arise, or if there is any other problem, the RN may follow up with the patient herself if required. The second flowchart, which explains the consultation between a registered nurse and registered medical practitioners at primary health center, health and wellness center level. Patient visits primary health center, and RN identifies the patient and makes the either makes the new registration or she may confirm the old registration, and she does the assessment by RN. And this PSC level health and wellness centers are led by RMPs, so they are expected to be available in the PHCs. If in case patient requires emergency care and RMP is available, then she would communicate the patient related information to the RMP after the obtaining consent from the patient through in-person consultation, and provides immediate first aid, the immediate relief measures or first aid and as suggested by RMP, and guide patient for referral to the nearest healthcare facility, either community health center or district hospital or any private healthcare hospital. If in case RMP is not available in the primary health center, then obtain consent from the patient and family member, and she initiates teleconsultation based upon the needs of the patient. Could be a audio, text, or video consultation with the RMP, and the same thing, she provides immediate relief measures and guide the patient for the referral for the higher center for the necessary care. If patient do not require emergency treatment and RMP is available, then RN should communicate patient-related information and facilitates in-person consultation. If RMP is not available at PHC, then after obtaining consent, she would initiate teleconsultation with the RMP. Based upon the registered medical practitioner's suggestions, they provides clinical care, health education, and counseling within her professional boundaries, and she documents the same. And third flowchart, consultation between a registered nurse and registered medical practitioners in a community setting. Usually in community setup, registered ANMs makes home visits. At the same time, RN also, depending upon the based upon the condition of the patient, they make the home visits. And maybe other community interactions would be health camps, mobile medical units, etc. when the RN reaches the patient's home, she explains the patient about the purpose of the visit. She identifies the patient, she introduces herself, and makes the assessment, which includes physical and mental health status of the patient based upon again protocols and guidelines. If no new complaints is arises, then she provides routine nursing care and she does the documentation. If any new complaints are there, or registered nurse suspects that patient requires an evaluation by the RMP, or in case patient requests the RN to teleconsultation with the RMP, then she obtains the consent from the patient and family members and initiates teleconsultation with the government setup or private setup, and she provides the care as suggested by the RMP. The another situation we have taken is consultation between a registered nurse and registered medical practitioners in an emergency. Proposed setup in India, the emergency medical services model we follow is 108 ambulance service, and it is recommended that ambulances should have telemedicine devices such as speakers, screen, and 360-degree angle cameras, which should be fixed on the ceiling of the ambulance, so that it will provide real-time bidirectional audio-video communication between the RN and RMP, so that they can provide essential health services in a timely manner to save the patient's lives. And it is also recommended that ambulances should be well equipped with not only with emergency medicines, also with cardiac monitor and defibrillators to provide basic life support and advanced life support. This is the situation in any emergency situations like road traffic accident, stroke, heart attack, or emergency delivery, or any kind of emergency situation. The patient or bystander calls the 108 number, that is the 108 call center. In 108 call center, a specially trained person receives the call and collects the basic information about the emergency situation. If in case of road traffic accident, how many individuals involved, and where is the place, location, all these basic details will be collected by the person at the 108 call centers, and based upon the severity of the situation, he dispatches the ambulance. At the same time, the officer alerts the EMS at the nearest hospital. From here, telenursing consultation starts from here. When the RN receives communication from the 108 call center officer, then she collects the basic information about the emergency situation like place, location, and severity of the incident, and she initiates teleconsultation with the patient or bystanders, so that she can briefly assess while traveling itself, so that when she reaches the scene without delaying, she can help the patient in their survival. And when she collects the basic information, she also alerts the RMP at the nearest hospital, and both of them work collaboratively in helping the patients on the scene. When she arrives, she assesses the scene like airway, breathing, circulation, and disability. If there is any profuse bleeding, she may try to stop bleeding using tourniquets and start resuscitation in case of heart stroke or anything. And the next step is, if healthcare facility, either government or private, is nearby and RMP is available, she should initiate the teleconsultation with the RMP. Could be bidirectional audio video communication, and and the suggestions given by the RMP, she administers the first aid, and she accompanies the patient to the nearest healthcare facility for further healthcare services. If healthcare facility is far away and RMP is not available, then she should initiate audio video consultation with the RMP, and the RMP should obtain consent and identify himself or herself to the patient or bystander, and he provides live instructions to the RN. Could be few examples: stabilization of the patient, connecting the oxygen or connecting the cardiac monitor, administration of medications, IV fluids, monitoring vital signs, immobilization, and transportation of the patient to the nearest facility, and documentation, what procedures they have done, what drugs they have given during the pre-hospital period. With the other details, she will hand over the patient with the documented charge to the RN and RMP in the emergency department. And other situations where telenursing practice can be enabled, for example, e-home visits. Patients may be geographically distributed. In those cases, RN can make virtual home visits to inquire about their health condition, or if they require any virtual home visit, if they require any evaluation by the RMP, she will facilitate the teleconsultation. And post hospitalization is another area. Recently, short hospitalization is preferred by the both patients as well as the healthcare providers to avoid nosocomial infection at the hospital, especially surgeries. And first 12 to 24 hours after the discharge at home is essential, where the RN can make e-home visits and help the patients if he requires anything. And RNs also in the hospital, they can make discharge summary advices as an educational video in patient's own language, so that we can ensure that the patients are adhering to the discharge advices. And also they can provide in the discharge summary sheet itself should have any contact number for telenursing consultation. So if they have any queries, they can consult the nurses at any time. The another area is maternal and child health nursing care. This is one of the major area. They can provide essential services in health promotion as well as at all levels, maybe primary, secondary, or tertiary levels. They can help the mothers and children in receiving healthcare appropriately in timely manner. If in case of antenatal and postnatal mothers, they can educate on diet and next visits, vaccination, and especially in first time mothers, they can have prenatal health education to reduce their labor anxiety. And the interventions will be many more. They can form support groups like antenatal mothers one group, and they can give health education from sub-center level or from health and wellness center level itself. The other area is geriatric nursing care. As we all know, geriatric patients require special care. As the age increases, they will be suffering from multiple impairments, maybe chronic illnesses. And so telenursing is one opt area where we can improve the autonomy of the elderly people, and also we can enhance their quality of life. And one important thing is we have to make them understand how to use smartphones, how to make audio video calls to the healthcare providers, and how to report themselves about their symptoms and problems. Another important area is mental health. At large level, the RNs can be involved to educate the public in their mental health promotion using various strategies. And also it is very very useful in educating public on bringing awareness on cessation of tobacco or alcohol abuse, and maybe to prevent the relapse. In like this, so many areas, even in mental health, they can provide healthcare services to the unreached population. These are the assessment forms we have developed, maybe optional. And this is a consent form. And when it comes to acknowledgements, we are very thankful to Dr. Chetan Baswarajappa and Dr. Paridija, Dr. Hemalata, Dr. Shobha Rani. We had multiple Zoom meetings on this guideline, in development of these guidelines, and they have given their valuable comments. And I'm very thankful to Dr. Shobha Rani. Every time, whenever she gets any new suggestion, she will call me up, or she will message me what to include. And I admire your passion towards our profession to help the needy people. And I'm also thankful to Dr. Deepak Agarwal, Professor, Department of Neurosurgery, All India Institute of Medical Sciences, New Delhi, and Miss Matilda Rabin, Senior Nursing Officer, All India Institute, AIMS, New Delhi, who initiated hospital-based telenursing services at AIMS. And thank you, Matilda, for sharing your experiences with us, so that we could able to improve our draft. And also I'm thankful to Professor Girjamba Devi, Secretary, TNA Karnataka State Branch, and Principal Marthi College of Nursing for your valuable inputs. And I'm thankful to our department faculty, Dr. Sailashmi Gandhi, Professor and Head, Department of Nursing, and Prashanti Natala, Additional Professor and Dr. Radhakrishnan, Associate Professor, for their valuable inputs and constant support to us. And I'm especially thankful to Mr. James, who sat with me whenever I called, in spite of, though he's very busy, he was extending his inputs, and we had discussions, a lot of discussions while making this draft. I'm especially thankful to Telemedicine Center Chief Dr. Suresh Badamat, who has given a platform for us to prepare this draft and be with us. Whole community psychiatry team was with us in development of this draft. We are very, very thankful, sir. Though you are part of our development of draft, we are just instrumental for your exemplary vision. Hope your objectives will be achieved. And thank you, Ananda.
Thank you, Dr. Vijayalakshmi. The tremendous work that has gone into the preparation of the guidelines is clear from your presentation. We all look forward for receiving the draft in the NIMHANS website. As I said earlier, it will be freely available for the public from the NIMHANS website in a week or so. And also, if you're interested, you can drop in your mail IDs into our chat box and we'll get back to you with the guidelines. We'll now have an open session. The participants can discuss their queries or any comments if you have. We have the experts, Professor Suresh Brahmat, his team, as well as Dr. P. Vijayalakshmi is there with us. We can have a discussion in case you have any queries or any comments on this. We are also happy to note that there are a lot of encouraging comments that we are receiving in the chat box. We are extremely thankful to all of you, and we look forward for all the for much more involvement and encouragement in all our future endeavors as well. Thank you for all those encouraging comments that we are receiving in the chat box. Thank you so much. If any of the participants have any queries, please drop them in the chat box. We'll be happy to answer them. Or in case you raise your hands, we can unmute you. We can have discussion here. If any of the participants want to unmute themselves, Ramchandra sir, sir.
An excellent initiative. Very, very good evening to you all. Very good evening to you all. An excellent initiative in need of the hour. And the presentation was very nice. From inauguration till now, whatever the procedure has adopted is excellent. The nurses need to be very confident. That's very important. And the need of the hour, they need to be non-judgmental and keep the integrity on time. And see that they need to see that all the things will be documented. So in that context, what Madam Redava has told, that need to look into what they are going to speak. The principles of psychiatric nursing need to be maintained. For example, recently I had a conversation with one of the person who is from different place, that is Arsikere, near Arsikere. And while talking, he asked me one question. Sir, who has a term midwife? What is the meaning of midwife? Please tell me, sir. I could not answer. Can anyone throw a light upon who has coined the term midwife? That's very difficult to answer. I did not answer, but I defined what the nurse is doing, what the midwife's activity is being done, and who is the great person who has termed the midwife. I could not answer that. So in certain to be maintain the matter of fact attitude. In that context, I think to be very cautious while answering. But I, of course, even now, I do not find the answer for that midwife. Anyhow, thanks for the proceedings that has been done. Excellent initiative. Wish you good luck.
Thank you so much, sir. Thank you so much for your encouragement and participation in the program. We are happy to continue the work that you have been doing at the college, and we are happy to continue it with under the able guidance of Professor B.V. Katyayani. Thank you so much, sir. I hope we do not have any queries or any comments from any other participants. I may now request Dr. G. Jyotimani, College of Nursing, to kindly deliver the vote of thanks.
Good evening to all. we have come to the end of the program. I take this opportunity to propose vote of thanks. Firstly, we thank our beloved director, Professor G. Gururaj, for his kind support and delivering presidential address for launching the NIMHANS tele-practice nursing guidelines. We extend our sincere thanks to our Registrar, Dr. Shankar Narayan Rao, for his encouragement and support. We thank all the deans for their constant support in this endeavor. We extend our sincere gratitude to Dr. Dilip Kumar, President, Indian Nursing Council, and ex-nursing advisor for Government of India for his gracious presence and support. We thank Major General Dr. Ashok Kumar Singh, retired President, Telemedicine Society of India, for his gracious presence and his unconditional support in this juncture. We extend our deep sense of appreciation to Dr. K. Reddamma, former Senior Professor and Dean Behavioral Sciences, NIMHANS, and Nodal Officer, National Consortium for PhD in Nursing, for her support and guidance. Madam is always there with us in all our endeavors. Thank you, ma'am. We extend our gratitude to Professor Roy K. George, National President TNA, member Indian Nursing Council, for his presence to grace this occasion. We sincerely thank Professor Dr. Pratima Murthy, HOD Department of Psychiatry, for her unconditional support, and we thank all the faculty from NIMHANS for their support. We extend our thanks to Dr. Sai Lakshmi Gandhi, Professor, HOD Department of Nursing, for her guidance and support. We thank Mrs. Nirmala Hatti, DNS and in charge head Clinical Nursing Services, for her support. We go short of words to express our appreciation and gratitude to Professor Suresh Badamat, HOD Telemedicine and Community Psychiatry, Professor Dr. C. Naveen Kumar, and N. Manjunath, the Associate Professor, who have been part of the program as well as instrumental in the preparation of this draft. We thank all the reviewers for their constructive suggestions for the improvement of this draft. We also thank Mr. James Paul, Nursing Officer and PhD Scholar, for his support in this endeavor. We thank all the teachers from the College of Nursing for their encouragement and support. We also thank the administration for providing the Presidential Chamber for this occasion, and staff and technicians from Biomedical Engineering Department for their technical support. Lastly, we extend our thanks to all the students of College of Nursing for their presence. Once again, we thank each one of you for your gracious presence, for making this program a grand success. Thank you, one and all. Thank you.
Thank you, Jyoti. We are ending the program now. I thank each and every one of you for your participation, all the dignitaries, all the speakers. Thank you, each and every one of you. And we look forward for much more collaboration and encouragement from your end in all the endeavors of NIMHANS and College of Nursing. Thank you so much. Let us call it a day. Thank you so much.